I want to read your post and then maybe have you elaborate on what exactly you meant, and what you meant by it. You said in your post, pharmacists want to check patient for flu and strep throat and then treat them. I would like to humbly request the lawmakers not to make medicine a joke. So what did you exactly mean by that?
Because, what is going on is medicine was supposed to be done a holistic thing. What we are not doing is, look, you take care of my toenail, you take care of my foot, you take care of my hand, you take care of my shoulder, somebody checks my throat, somebody does my nose swab, So that holistic approach of medicine is no longer there, that is not the right way to do medicine. And many people are angry that, okay, so many urgent cares are doing that, so many primary cares are doing that, so many people wrote on that post.
Mm-hmm.
I do agree with that. I mean, doctors do wrong things too. I'm not saying, but that doesn't mean that we have to join them. If somebody's doing wrong on a street, I will not join and let's try to reform the system. Let's do a system-wide change where we pharmacists, I have a utmost regard for pharmacists, So the response I get is as if I've offended pharmacists. Pharmacists call me daily because, Dr. Moolani, this patient's creatinine clearance is this much, you want to check the medicine, especially in nursing homes. They tell me all the times, patient's Depakote level is high, patient is on antipsychotics, new patient, 2 antipsychotics, you want to cut down 1. They call me so many times,
Yeah.
And just amazing value they provide to me. There is no denying of the fact at all. They, pharmaceuticals, they know more than me. There's no denying of that fact.
Mm-hmm.
But again, doing medicine is a holistic thing,
Yeah.
So
there was.
Should I finish this?
Yeah. Go ahead.
So, for example, when a patient with flu symptoms comes to my office, okay,
mm-hmm.
First, my nurse checks it, make sure that person has a mask, and checks the vitals, and make sure she tells everyone, look, this might be flu. So we take our own precautions, wear mask, wear gloves, and all those things. And then I don't just check for flu,
Mm-hmm.
I do the thorough checkup of that patient, make sure patient doesn't have sore throat, make sure patient doesn't have ear problem, make sure patient lungs are clear, because so many times a patient can come with flu symptoms, but he or she has pneumonia,
Mm-hmm.
So it is not, medicine should not be, okay, this part I will do and this part you take care. Then we are increasing the cost of medicine. We are not decreasing the cost of medicine. We are just spreading it. Okay, let's make everybody equal. Then what's the point? Then what will happen is, then instead of me feeling pharmacist as my colleague and my right hand, literally, now I feel that if I send patient to pharmacists, they will take over my patient. So then if we have this barrier between physicians and pharmacists, it's not good for society. Or we have been working together for decades. How is it going to help the patient? If there is a primary care shortage, or there is a shortage of the people, healthcare providers who prescribe medicine, they are now nurse practitioner, physician assistant. It's not just a doctor. So then we should make sure that these people are put in place. But now we will give additional role to pharmacists. And I'm 100% sure, because I talk to pharmacists all the time, they don't want to do that either, especially when they're employed. They say, I have enough work. I don't have time to do strep test and flu swab. I wrote this post because a few months ago, a pharmacist came to me. She wanted me to sign a collaborative agreement so that she can do flu test and strep test. And I did not have a clue at that time that it's something like that pharmacists can do. And So, many people are saying collaborative agreement and they sign with collaborate. This pharmacist is 5 miles away from my office. Okay?
Mm-hmm.
So I'm not checking what she's doing. I'm just signing a paper. I'm just signing a paper for her. I have no clue what she does in the, like when she prescribes Tamiflu, is it right or wrong? If when she is giving medicine for strep throat, is it right or wrong? I have no clue. Like many people said, I do not have any clue what collaborative agreement is. That is not right. I have some clue.
Yeah, I was just about to say that. Someone commented, you have a poor understanding of collaborative practice agreements.
Yeah, collaborative agreement. I just signed a paper. They are working in their pharmacy. They are not working with me, next to me. They are not going to call for every flu. And even if they call, what will I say, Whether it is better that I tell them to send it over then.
So you did sign the paper that the pharmacist brought?
No, I did not sign the paper. I did not, because I did not feel it right at that time. I did not sign it. I mean, I see pharmacists as my colleagues, and I call them
Yeah.
I call them all the time, literally, because they provide such a good, especially when recently I stopped going to hospital. When I used to work in a hospital, they will call me about antibiotics, antibiotic dosages, and all that. That was such an amazing service they provided to me. Such an amazing service.
Mm-hmm.
I have nothing against some people. People just, I think women got mad and I don't know why they got mad. I mean, they might have some other reasons also. They got mad because maybe I wrote it in such a way that they got mad. I'm sorry about that.
I think a lot of people would maybe think that you taking away the credibility of the pharmacist and not giving
I have
as
never
much.
taken away credibility of pharmacists. I literally have utmost respect for them because what they do, as I've said before, I mean, just multiple times today I said, even in those posts I've written.
Yeah.
You can go over all my remarks. I don't have problem with what pharmacists are doing. I mean, to be very frank, so many times I write wrong dosage of a medicine and they call me, Dr. Moolani, you really want to give this dose,
Mm-hmm.
And then I realized, oh, wait a minute, you're right,
Someone commented, they said, what happens to the patient who is sick but can't go get an appointment with their physician? Are you volunteering to stay late and work weekends just to screen the patients for the flu?
Okay. So, for example, I'm not there. Does that mean, I just already said that. Does that mean we should have physicians or we should have pharmacists do that? I cannot be present 24/7, just like a pharmacist who is not present 24/7. He also works some shifts,
Mm-hmm.
Many of them are working 12 hours, 8 to 12 hours,
Correct.
There are 3 days, 12-hour shifts. And I'm appalled to hear one of the pharmacist friend, he told me that they don't even get a lunch break.
Yeah.
According to state law or federal law, I don't know which law was that. They don't get a lunch break. I was, wait a minute, what is that nonsense? So they work like robots for 12 hours. So they work like in shifts. Similarly, physicians, they not work like shift, but they work in the office hours. There are urgent care centers which are open late. So if just physician is not available, that does not mean we can have somebody take the role of physician. If, for example, a registered nurse is not available, that does not mean a LPN will take care of her patients,
Mm-hmm.
That is only when we cannot in any way get a RN. We are in a bad situation. Otherwise, RN's role is done by RN, LPN role is done by LPN, pharmacist's role is done by pharmacist. Yeah, I mean, I don't have a problem. Everybody has a role to play, and everybody should play that role.
Correct.
And why would anybody want to take a liability? What is the reason? What is the reason? Like, to improve the care, like pharmacists say, okay, look, we need more physicians. Okay,
Mm-hmm.
instead of saying. So then, like the doctors can say, okay, we don't need pharmacists, we need more physicians. Why do we need pharmacists? Well, we can run protocols and algorithms and all those things. But that's not right. That is not right. We have to work not in collaborative agreement, which is written, but right in a good sense of collaboration where we help each other grow. We help each other support. We help support each other and help our patients. That should be our goal.
What do you think is
Right?
the main reason why physicians don't want to sign that collaborative practice agreements with the pharmacists? What do you think that is?
I think it is a liability, some liability for me, which to be verified, I do not know whether there's a liability or not. But somebody is doing over there. I do not know their credentials.
Mm-hmm.
I don't know the person's credentials. I know she's a good pharmacist, okay?
Mm-hmm.
But how do I know what is her clinical acumen? You understand what I'm saying?
Yeah.
How do I know how good she is clinically? For example, I won't sign it for my son even, Well, I might sign it for my son because I know him and I'm out of love of him, okay, I might sign. Okay, but what, again, you get my point, what I'm trying to say that I don't know that person, how good that person is with the hands, how good that person is with the physical examination, how good that person is with the history,
But that's some of the points that some people were making in your comments, that a lot of, some people can say the same things about physicians that you don't know.
I don't know physicians, so I'm not signing any collaborative agreement with them. I'm not signing. I mean, they are doing under their own license. I'm not signing any collaborative agreement with physician. They are all working on their own license, and same here, So, yeah, I mean, so
what would you?
Maybe I don't know many things, but this what I made is very clear. I mean, that I am not against pharmacists at all. How can I be against pharmacists? They help me a lot.
I think a lot of people were saying do it because like the training and schooling that pharmacists go through, that we deserve to have a collaborative practice and be recognized as healthcare professionals.
Well, then why don't go to medical school and do it in a completely right way? Just do whole thing. Why just do strep test and flu test? Just go to medical school. What's wrong with that? Go to medical school. There's nothing wrong.
So then we won't. If everyone went to medical school, then there will be no pharmacists.
Yeah, that is true. That is exactly, you're right. You are making the right comment. That the pharmacists should go to pharmacist school and they should do pharmacy, and the medical doctor should go to medical school, or medical student should go to medical school and do medicine.
And in your eyes,
why we want to blur the lines? What is the reason we want to blur those lines?
In your eyes, what is a pharmacist's role in your eyes?
I think whatever role they have been playing till now, they are doing a perfect job. Literally, I mean, they are doing a perfect job of what they are doing.
What do you think that is? Like, what do you think?
Like for example, I write a medicine, or sometimes bunch of medicines. I mean, they dispense the medicine, they check the interaction, they check the adverse reaction, they check everything before they dispense the medicine. And they do a much better job than literally I do, because that is their expertise. They are doing that job much better than I'm doing, literally. I mean, so that is their expertise. But my expertise is not just writing prescription. I'm a diagnostician too. I diagnose also. Diagnosing is a completely different thing, which I got really good training in diagnosing. It was not, not. So that's what I would say.
So
I learned to diagnose people and different things. For example, a flu patient comes. Many of the flu patients can have high blood pressure on that day. When they are in my office, for example, they will say, Dr. Moolani, hey, my sugars are running high. Can you check my toes also, because I noticed there is some fungus, So when they are just in my office, they are not talking flu or strep. They are talking of like holistic thing, like because they know me. You can follow me on Facebook. You know how much my patients know me. My business page. So they know me, and they want a holistic treatment, and that is the problem also. I mean that other thing that now there are so many urgent care centers and who are doing, as you may say, that we are doing the same thing which pharmacists want to do. Yeah, you can say that, but again, that they have that training in that thing. Pharmacists have their training in their own speciality. So let's have a demarcation. If we will not have demarcation, then what will happen is physicians will feel that their role is being taken over by somebody else. Then we will not have good quality physicians. Then the best students in pre-med will not go to medical schools. Then, for example, my son wants to go to medical school. I will discourage him from going to medical school, I'll say, okay, your job will be done by somebody else. What's the point? Don't go to medical school. Do a health administration job, You will earn more money. You may not earn more money, but hey, you will be controlling things. Here, physicians don't, it seems that they can lose everything. Now, slowly, what's the point? Why we want to lose the demarcation? Why we want to create a friction between pharmacists and physicians? Why we want to do that? Yeah. Why not work in a collegial environment we have always worked? We have always worked very closely, always. So why not continue that?
So if you were to give one last message to everyone that's, I guess, looking at your post, because it's blowing up, and what would be your last message to everyone?
I would say that the way we have been working, it has been working very good, well. But if we will blur that line of physicians and pharmacists, then it is not good for the health of patient. It is not good for health. We should work in a way, like everybody said, we should work in a team. Yes, we should work in a team. I'm not saying we should not work in a team. We should work in a team where I need advice for everybody, and I can tell give me advice, all types of advice when I'm writing prescription. Catch my mistakes, which I do a lot. I mean, not just me, all the physicians make mistakes while prescribing. If you're a pharmacist, you know your physician, you know how many mistakes physicians make. It's just like a mother knowing how many mistakes the kids made when they were growing up. Same thing, pharmacists also know a lot about physicians. But why take over prescribing? Like if you are saying I make a lot of mistakes by doing prescribing, why you want to make those mistakes, Yeah? Why you want to make those mistakes also? You can do a better job of correcting my mistakes, and we work as a team. Yeah, correct my mistakes. I don't have a problem. I'm not saying I'm perfect.
Okay. So before we hang up, can you just give a little bit about yourself, your credentials? Where did you graduate? Where did you go to school? How long you've been practicing, and anything else you want people to know about yourself as far as your background?
I graduated in 1997 from Dow Medical College in Karachi, Pakistan, and did my residency in New York, Bronx Lebanon Hospital, and I'm practicing as an internist for last 15 years in Owensboro, Kentucky, and I just wrote a book also.
What was the title of the book?
Tough Decisions in Care of Elderly Loved Ones. It was released last month.
Okay.
It was released last month, and I like what I do.
Yeah.
And it is not that, and I do not. There is nothing like I want to confront anybody.
Mm-hmm.
If you'll see, I did not say like I hate pharmacists or anything. There is nothing like that.
Yeah.
I did not say in a whole post. You can
Yeah.
see all the comments. I never said that.
Well,
Many people call me ignorant and all that thing, But again, this is not against anybody. It is, and I'm not saying in that whole post you can see, I'm for teamwork. In fact, I love it when the pharmacist, you can check with, I go to a couple of nursing homes. They will tell me how much I like the pharmacist and how much medicine deep prescribing I've done. I mean, you see my posts.
yeah.
I do this write about deep prescription all the time.
Mm-hmm.
I don't know whether it increases the business of pharmacists or not.
Yeah.
But
Well,
I'm all for health care of the patient.
That's awesome.
I mean, real good health for patient. It is not about me. We should not be fighting as like all of us should help each other.
Yep.
To
I
grow
agree.
and help our patients. So that is the goal. That should be the goal of everyone.
I agree. I totally agree with you, Dr. Moolani. Well, thank you so much for taking the time to speak with me. Hopefully, when we put this out, it'll clear out more of what you meant to and tried to say in your post.
Yeah, I hope that it clears all the misconceptions. I did not want to be part of any misconceptions. I'm against misrepresentation. I've said it before also, but not to. I really want to do medicine, and it does not mean that I'm a perfect doctor at all. Does not mean. I mean, I have my own shortcomings, like just any other physician, any other human being.
Correct.
Yeah.